Welcome back, everyone, to Arthritis Broadcast Network's second annual Greek to Street event, an initiative started around the Knowledge Translation Canada Scientific Meeting, which took place last week in Winnipeg. We believe the magic behind good knowledge translation is getting language and ideas that sound like Greek out to the street, so people can put scientific knowledge into action. My name is Maya, and today we are excited to be speaking with Dr. Heather Gainforth, ICORD Principal Investigator and Assistant Professor at UBC Okanagan, and Michael Smith Foundation for Health Research Scholar. Thank you so much for joining us today, Heather.
Thanks for having me.
Can you tell us a bit about yourself and what you do?
So I am a researcher at UBC Okanagan. So we're based in Kelowna, British Columbia. And as a researcher, my interests lie in developing, implementing, and evaluating behavior change interventions that we aim to ensure are used in the real world. But I'm also interested in developing the science of integrated knowledge translation. And basically what that means is that I'm really interested in understanding research partnerships, so how researchers can work together with people who use our research throughout the entire research process.
And you were involved with two poster presentations that were presented at the KT Canada Scientific Meeting. Can you tell us about both of those projects?
Yeah, so actually both of those projects fit with my interest in research partnerships. So in our lab, we're really interested in not just working in research partnerships, which is a cornerstone of everything we do, but we're also interested in advancing the science of partnerships, understanding what makes partnerships work, and in particular, what makes partnerships work in the area of research and how we can make those better. The first project was coming from my postdoc student, or not student anymore, postdoc researcher, Femke Hoekstra. So one of the key presentations at KT Canada was a study looking at the principles, the strategies, the outcomes, and the impacts of research partnerships, and in particular looking at a review of reviews. So what we did is we looked at a whole bunch of reviews in the literature, actually a painful number of reviews in the literature. So in total, we included 86 reviews of the literature around research partnerships. Wow. We wanted to understand what were the things that made partnerships tick based on those reviews. So what makes partnerships potentially work in terms of what principles are they using, so the beliefs and the norms, what strategies, how do they actually get that partnership done, and how do they work together? What are the outcomes and the impacts, or what happens afterwards? What are some of those benefits of partnerships? And in that sense, what we found is that there's a really large variety of different partnership approaches that are used around the world. So there's terms like integrated knowledge translation that's used. Patient and public engagement or patient and public involvement is primarily only used in the UK as a term. But we also see other terms like community-based participatory research, or we see terms like participatory action research. But at the end of the day, what all those terms are telling you is that people are partnering. People are partnering between researchers and research users, and often that the goal is something around impact. And then I guess if we think about the principles and the strategies underlying them, we were able to identify 17 overarching principles that look at how researchers work together, as well as 11 overarching strategies that can guide researchers and research users to work together in partnership. And really where I think the value of this review is that it starts to actually provide an extensive set of research partnership principles, strategies, outcomes, and impacts, and helps to guide people through the literature of research partnerships. I think a lot of people are considering that they want to be a part of a research partnership, but maybe don't know where to go or how they can learn from other people. And so I think the findings from this review can be really valuable to other groups thinking about how how do I work in partnership?
And so what did you find from that research project that you were saying are the key strategies to have a successful partnership?
Yeah, so a few examples in terms of principles. So one would be that partners build and maintain relationships based on trust, credibility, respect, dignity, and transparency. And another one would be around the idea of partners being flexible and creative in their collaborative research activities, and that they're tailoring the approach. So partnerships aren't necessarily one size fits all. You're probably going to have to take different approaches for different groups that you're working with. So I wouldn't say that in terms of outcomes and impacts that we have a really good handle of outcomes and impacts of partnership right now based out of this review, because one of the challenging pieces of it was that people talk about outcomes and impacts in kind of confusing ways, is one thing I would say, but that we were looking at different pieces around how researchers conduct partnered research, the relationship between researchers and stakeholders, the impacts in terms of community and society, and being aware that in that process that it will require time and effort and those pieces. And I actually think that potentially our second poster dives down into the challenges piece a little bit more. So
how did you, or how is your group, if you are planning to get that knowledge to researchers looking to have successful IKT partnerships?
Yeah, fantastic question. So our group is really excited. We took a coordinated multi-center team approach to actually do this research. So in order to conduct the review, we had to work with researchers at the University of Ottawa, the University of Calgary, UBC, the University of Manitoba, Alberta Health Services, and the Ottawa Hospital Research Institute.
Okay, wow.
So it took a lot of us to be able to actually get these reviews done, because the research partnership literature is so diverse and actually so complicated. So the review of reviews is the first step in actually a three-step process that will eventually include 5 reviews on the IKT literature and research partnership literature. And the review of reviews was led by Femke Hoekstra and my lab here, the Applied Behavior Change Lab at UBC Okanagan. And the reason that we were interested in doing this was because the question about what are the principles and strategies of research partnerships actually came from our community that we are working with. So we primarily work in the spinal cord injury community.
Okay.
And their question to us was, how can we help researchers and research users better partner together? And can we create guiding principles that are co-developed with people with spinal cord injuries? So what we said is that we actually needed to get a long list of options of ways that people could partner, and then actually, as a group, decide which ones we wanted to work with. So our next steps in our process related to this project are to actually use the findings of the review of reviews to develop integrated knowledge translation guiding principles for conducting and disseminating research in partnership with people with spinal cord injury. And we recently received funding to be able to do that work. And so we're bringing together researchers, we're bringing together funders in the area of spinal cord injury, as well as research users, people with spinal cord injury, clinicians, and spinal cord injury organizations from across North America to actually co-develop those guiding principles and then make sure that they're disseminated and implemented in the real world area of spinal cord injury, that they are developed with people with spinal cord injury and for people with spinal cord injury.
That's really great. I mean, I think it would be so ideal if that could be done for every patient group or sort of category.
And I think over time the review that we're talking about may become that first step for a lot of groups that are thinking about developing a flexible approach or guiding principle for working in areas like arthritis or working in areas outside of spinal cord injury or maybe disability more broadly.
Yeah.
And the second poster came from Rhyann McKay, my Ph.D. student who works here at UBC Okanagan. And she had done a really interesting project about 2 years ago with the Okanagan's Milkameen Division of Family Practice. The division came to our lab and asked us questions around why people were maybe using the emergency department when it probably wasn't the most ideal place for them to be in terms of receiving the best care. So they might be going to the emergency department for something that wasn't necessarily severe enough for the emergency room, and they wanted to see how could they better support patients to get where they needed to go.
Mm-hmm.
And so we used behavior change theory to understand why they were doing what they were doing. And that's an interesting piece of the project in the sense of understanding why people go to the emergency room. But one piece that we forget about in terms of reporting our methods, thinking about integrated knowledge translation, is that we actually forget that the research partnership piece of our science is a research approach in itself, and it's something that we should be reporting on in addition to the methods of our studies and the findings of our studies, because we can't understand partnership if we don't retrospectively look at what made our partnerships work and maybe what made our partnerships more challenging. So what our team wanted to do, because this project, one, came from an organization that was looking to make real-world impact and change, and then it was partnered the entire way through. So we worked with the South Okanagan Milkameen Division of Family Practice, developed the surveys, the methods. We did the analysis together. Everyone came up to UBC Okanagan and we analyzed our data together. And then they actually implemented findings in their division from this project. But what we wanted to say was, well, what made our partnership work? And what was maybe challenging, so that we could help other partnerships that are considering doing research in this way to learn from us. And so what we did is we asked everyone on the team to think about the strategies and the factors that they found were supporting our partnership, as well as the strategies and the factors they found were impeding our partnership. So what made it easy to work together, and what made it sort of hard to work together? And when we looked at that, what we found was that there were lots of strengths in terms of our researcher roles and our skills. So we were well matched to what the team needed. We had democratic leadership, so there wasn't one person holding all of the power in that relationship. We had common goals and objectives, so there was benefits to doing this project both for the division as well as for our research team, or the researchers on the team. We jointly developed how we work together and our norms. We had the involvement of team members and staff members from their organization that were able to support us, as well as community members that were able to support us. We had the presence of people on the ground that were working in the emergency department that could help us think through that. We had emergency room doctors on the team, and that was helpful. The involvement of students was really valuable in terms of thinking about students were very helpful in getting things done, but also helping in terms of organizational leadership and expertise. That we had our meetings very early on to establish our working relationship, and that we started to develop skills and tools together that we could use as a team. So that really helped us. That doesn't mean that our partnership was all, rainbows and unicorns. There were still some hard things. So, and these are things that I think would be uncommon for many groups. So we had challenges in terms of how could we meet. So times and schedules, we're working with doctors that are working in the ER department, so they have different times and schedules than, say, researchers or even staff, and how we made that work. Competing priorities of organizations involved in the partnership. So we were still successful in our project, but we did have to navigate the priorities of the students working on the project. They had things they had to do in terms of their schooling. Myself as a researcher in terms of what UBC expects of me and my outputs, as well as the priorities of the division and what they needed. We found that over time that the timelines of our organizations or our priorities shifted in terms of when students move on to a new project or what the organization is working on at that time, we were constantly having to be flexible and kind of coming back to that principle we talked about from the other project. How we shared our learnings was sometimes challenging if we could meet face-to-face or ability to actually talk through those things. Another one was access to data. So how do we share data between the two places, and where does the data live, and how do we navigate those pieces? And actually, this was our very first partnership that we'd ever worked on together, and so there were more things that we had to navigate as the first time in a partnership, much like when you're on a first date, there's more things to learn about. When you're in your first partnership, there's more things to learn about there too. So there were still things that we as a team had to really think about and address over time. And so we really feel like our communication strategies and our alignment as a team in terms of our shared values and goals helped us overcome a lot of those strategies, but that you still have to be aware of competing organizational priorities and regulations that you're going to have to navigate when you're going through a partnership.
I'm curious to know if you got the input from community members about what they thought about their involvement in the partnership.
Yeah, so we were really lucky on this project that the South Okanagan Milkenine Division of Family Practice had connections with the Patient Voices Network, and so they really helped us in terms of tailoring all of our research tools and methods throughout the project. And then in terms of knowledge translation on the back end with patients, that's actually where the South Okanagan, they really took over in terms of changing their policies and their approaches to next steps with this project.
That's great.
And so in the sense of doing a retrospective analysis on patients' experiences with working with us, we didn't look at that at this point, but I think it's a really good question moving forward, is to loop back to, say, Patient Voices Network and find out more about their experiences of working with researchers and how we can support them more in this process, because I think it's a really good question.
And we just have another question for you about the KT Canada conference, what you thought of the theme for this year's event, which was advancing the science of integrated knowledge translation, and as it sounds like it's a field that you're working very closely in, what does this mean to you? As in, where do you hope to see the field of IKT in, let's say, 10 years?
Yeah. Oh, wow. Great question. So I was very excited that the theme of advancing the science of integrated knowledge translation was selected for this year, and at KT Canada, Ian Graham and Anita Kathari were the keynote speakers. So that was really exciting because they are really some of the leading thinkers in the area of what is integrated KT, but not just the practice of it, but the science of it. What do we know about how IKT works, and what do we know about how we can help other groups be able to have more meaningful partnerships? And probably, as you can tell from our discussion today, one of my big interests is not just in working in partnership, but in understanding how partnerships can be improved and how we can support other people. So for me, I was very excited about the theme for this year's conference. And I think in thinking forward, in terms of integrated knowledge translation science, I think we're really at the infancy of the field. We're just starting to figure out, what are the principles, the strategies, the outcomes, and the impacts of integrated knowledge translation partnerships. And those reviews that I talked to you about, those 5 reviews, will start to explain that and hopefully get us some foundations moving forward to be able to think about how does IKT work. And also, though, those reviews, I hope, will start to provide frameworks and a common language that we'll be able to discuss more easily in between partnerships to learn from each other. Because when we don't have a common language, it's really hard for me to understand some of the factors influencing someone else's partnership and the factors influencing mind. So I think that's one area in terms of integrative KT that I'm really keen to see us as a field come together and think in common terms. And then the other one is to start to look at, well, can we build capacity for integrated knowledge translation? So once we have a good idea of some things that create quality partnerships, and I think we're getting more data in that area, is how do we build capacity in that? And how can we actually improve partnerships, which I think is exciting. And in that way, I think one of the key ways that we're going to be able to do that is, one, through reviews, understanding what has supported quality partnership in reviews. But I really think an area that we need to be thinking about for the future of our field is not just looking at single case studies or reviews, but actually looking for examples of prospective, longitudinal, multiple case studies where you have several partnerships working in similar contexts and following them from the beginning of that partnership to the end, so that we're not just seeing what I talked to you about today, reviews or retrospective approaches of what partnership looks like, but actually you're starting to see this very prospective, long-term timeline of what a partnership looks like and how it changes. So I think that the field is very open and there's lots of room for investigation, and lots of room to really support one of the foundational pieces of our science in the area of knowledge translation. So I'm excited to see where the field goes in the next 10 years.
Yeah, absolutely. Well, so are we. Thank you so much for sharing your perspective on that. It does seem like the research you're involved in is an important part of advancing the science of IKT. Thank you so much, Heather.